So for those of you who haven't joined us before, we are the Nurse Policy Entrepreneur Cafe, and our whole kind of shtick is that we don't necessarily talk about issues, we talk about the way to discuss them in a diplomatic way. And we see nurses as entrepreneurs in policy in that, we're disruptors. We are people who our voice matters in these spaces, and we advocate for our patients every day. And that also should extend to advocating for them in the policies that ultimately shape their health and the social determinants of health. So the way that the cafe works is we call it a psychologically safe space. So we come together, again, it could be over a cup of coffee or a bottle of water, whatever you have. But there's basically no right or wrong questions or comments in this space, and we facilitate what we like to call group mentorship. So we all learn from each other. We usually have, some nursing faculty, bedside nurses, non-traditional roles, students. So really, it's a safe space for you to come together and ask questions in a non-judgmental way. We record them, as you probably got a notification we came in. We're recording this now, but we only ever share them and post the components of the recording that we agree upon ahead of time. So for today, then Lincoln, if you don't mind, we can cut your presentation part out of this recording and maybe just put that on our YouTube and share that on our socials. But typically we don't share the discussion portion of this. So again, to kind of facilitate that, just that space where we can just be open and talk. And yeah, I kind of just went over that. Yep. Yeah, so a little bit of background on the NPE. So we were actually, Michael Polachek, he's not here right now, but I'm using his Zoom account. So my name is not Michael. My name is Angelique Conflenti. I'm a registered nurse, been a nurse about 9 years now. But Michael actually started the cafe back in 2022, I want to say, or 2021. And he noticed there was a gap in kind of the professional development for nurses, or just community, where nurses could kind of just like have these open conversations. But the NPE is special because it's unfunded and it's unaffiliated. So we're not, the things we talk about aren't being dictated by a larger organization. So we really have like full creative control of the kind of narratives we want to talk about with policy and how we want to approach it. So on the right here, you just see a couple things about what the cafe is all about. Exploration of processes and identity evolution. So we put some highlights on our LinkedIn and our community forum if you're interested. But we're also seek to be the go-to compendium for nurses interested in policy. Again, this is a space where anyone can come and ask any questions. So we really want to be that resource. And we have a great website. It's simple, but it's effective, that we can link to later. It has some really great resources about all these different elements of nurses engaging in policy. And we want to be thought leaders. I mean, nurses, as Lincoln's going to share, are at the forefront of innovation in so many different areas of our field. So we want that to be part of our core identity as NPEs, or nurse policy entrepreneurs. And again, open to nurses at all levels and all settings, student, retired, nursing, at the bedside, what have you, everything. Everybody's welcome. So just some netiquette. As we said, psychologically safe space, discussing how to approach issues, not necessarily debate them, and structured group mentorship. The cafe is actually based off of the World Cafe method, which Michael kind of built this structure around. It's a really interesting idea. If you want more information, go ahead and take a look at that offline. But yeah, just the innovative exchange of ideas in that dialogue and listening kind of perspective. I think one of our last slides here. So just to share kind of going forward, Michael and Grace developed these NPE essential elements, and these are basically just, I think, 7, or 7 essentials that kind of, again, make up that identity of an NPE, but also the skills that we really should take a look at and see where maybe our gaps are, or where have room for improvement in order to engage in policy as nurses and thought leaders. So kind of today, we're going to be focusing on the technology essential. obviously AI here, collaboration apps, all these different things. But if you go on our website, then we have a tab for each of these, and it has resources for each granular bullet point. So if you're interested in developing yourself more on any one of these essentials, then we have a lot of great resources for you, and previous recordings on our YouTube channel as well, with speakers speaking to all of these great things.
Yes, you are the builder now. So yeah, first of all, so hello everyone. My name is Lincoln Gombedza. I'm a registered learning disability nurse. I'm proudly consider myself as a citizen developer, so someone who uses digital tools to innovate, create change, within healthcare settings. So without being a professional software engineer, although I do have a background, I've worked for Microsoft before in the past before I came into nursing, so I do have a little bit of understanding on software, solution architect, Solar, and computer science. I also have a background in criminal investigations as well. I also serve as a regional hub lead, for the Nursing Now Challenge. So I'm a member also for the National Digital Shared Decision Making Council. So these roles, they allow me to champion, the power of nurse-led innovation. So it's really grounded in real-world experience. So for the theme today's session, really, or for this presentation, is you are the builder now. So nurses are no longer just recipients of end-user technology. We can be the designers, and we can be the creators, and digital problem solvers too. So thanks to tools like, I don't know whether you've heard of Microsoft Power Platform, you got the Replit now, you've got Lovable, you got different AI assistants there. Google yesterday or the 2 days ago, they just released Firebase Studio. Effectively, you can just go and write a prompt and then AI goes and build everything for you. So, so that we can prototype, for me, is really about how do we design the nursing model now, with the arrival of these, artificial intelligence, agentic AI, to deploy practical solutions, faster than ever before. So there's a massive change happening in the digital space. Feel free to ask any questions as I go along. For me, digital transformation in healthcare is really rapidly changing in how we deliver, services, from telehealth platforms to, looking at the EHRs, our electronic health records. Digital tools are making care more accessible and efficient. But while technology is really more powerful, its impact really depends on who builds and implements it. So this is where we as nurses come in. So nurses have we've been long innovators, at the bedside, to be honest. So we troubleshoot in real time. We adapt processes, we lead on quality improvement. So now digital tools allow us to scale our ideas. So citizen development really allows us to create or to co-create the future of healthcare. So instead of waiting for external developers or digital teams to fix a problem, we can prototype, test, really refine our own tools using platforms, so they don't really require traditional coding. This is what digital nursing leadership looks like in the 21st century. Next slide. So this is vibe. I just went on ChatGPT. I know everybody's trending everywhere. Where you're creating all this. But as a nurse citizen developer, we combine digital tools, with clinical insights, to just focus on that digital capability. So we know the pain points, really, communication gaps, paper-based workflows, unnecessary duplication. So by using no code and low code platforms, we can bridge these gaps ourselves. So one powerful method, I've been using is called vibe coding. You've probably heard it. If you type on Google right now, vibe coding, what is it? So this technique really encourages rapid prototyping using visual logic. So for example, drag and drop interfaces. If you look at an A8 as well, and then AI assisted design. So it allows nurses, us to express our ideas through different workflows rather than looking at traditional coding. So vibe coding often involves tools like Microsoft Power Apps, Power Automate. I suggest everybody, any nurse, to learn how to use Microsoft Power Platform, because we already have Outlook, we got Office 365, so we are never going to replace IT. That's just never going to happen. But what IT are going to do is they're going to be gatekeepers of the technology, just like how they deploy Microsoft Office 365. They can deploy tools like Power Platform, Power Automate for us, and then we can really prototype and play around with some of these tools. But I'll show you a video on how we can do that. So, for example, so I mean, you can define what you want to drop and do. So, notify staff, update any care records, track progress, and the platform really it helps us to translate your intent into a working prototype. It's about capturing the vibe or logic of a task and express it, interactively. So, what are the results? Solutions built by clinicians for clinicians, intuitive and practical, grounded in real world needs, because we know some of these software as a service, for example, the traditional system one, whatever API used is quite static. Nurses are always complaining, it's always crashing, it's always that. I think those days are coming to an end, to be quite honest with you, because we're going to be seeing agentic AI as a service where nurses can think, okay, I need to build a handover app. I can just write the code, a prompt into the AI or in Microsoft Power Platform, which is secure because it's all been approved, with all these security standards. So any information you use within a hospital environment, it stays in a hospital environment. So data protection, we'll talk about that as well, which is very, very important. So I'll move on to the next slide. So what are the tools? The tools that empower citizen developers. So let's break down the tools that empowers citizen developers. So no code solutions. I've mentioned Microsoft Power Platform. There's another tools like Glide, of course, Google. When you look at Google as well, Gemini, and they released agentic space yesterday as well. So these things are happening every day. So you can just drag and drop different components, that you want to use to design. Maybe it could be a dashboard or a process workflow that you're thinking of. And then we got AI tooling for development. So tools like Replit, GitHub, Copilot, very, very, very important, because GitHub, what it does is once you write your prompts, the GitHub solution, right, it then automatically saves your code behind the scenes. So you can always have your code. And if there's any errors, I mean, you can always use ChatGPT to ask it, whatever. But the idea is, of course, we would want IT to be consultants. So you can always go back to a pro dev and say, okay, I've got an error there. What do you think we should do? And they can always have an oversight, which is what they already do with Microsoft Power Platform, to be honest. Again, Microsoft Power Platform, Power Apps, very, very important. Power Automate, please try to get in touch with Power Automate because it's very good. You might receive an email. If you're receiving so many emails, you can build a flow basically where it goes and analyze your emails and then you can do some response. That's agentic AI. But it's very good to have a basic knowledge on Power Automate. Power BI for data visualization, very, very good. It's practically useful in the NHS context, really, because it's secure. It's NHS approved as well in terms of cloud infrastructure. These are the things that we can talk about in the future anyway. You got Kesa and Replit, and I think that's the one which, they're all trending. So these tools, they make coding more accessible by offering auto-completion prompts to code suggestion, basically. So intelligence debugging, which is very important because you might vibe code an app, but at the end of the day, you need, if you follow me on LinkedIn, you see I wrote an article around, yes, the hype around vibe coding is there, but we also need to respect the security. It takes quite a long time for people to, computer science and debugging is part of it. When you get all these bugs and stuff like that, you need to be aware of what you're doing and everything. So this is why it's important. We all need to try to work together. So all these tools really support vibe coding, but by allowing you to experiment, to iterate, to design rapidly, in that low technical overhead. So you're always going to have the chief nursing information officer or the head of IT. They build, the environment, and then, they release these tools for us nurses to play around with to see how, before we actually start using it in our teams. So examples in action. So really to be honest with you, I did this today. And I want each and every one of you, because I was telling Angelique that I think we need to have a part 2 series of this, because today is just an overview, but I want everybody to go and try some of these tools, and then maybe by the time we have a second session, we could focus on how you can debug, what errors did you find, and all these other things. So I did a prompt, I just built a discharge planning tool, so I'll show you the examples in the next slide. An equipment tracker, a vaccine reminder system. This is just something that I vibe coded today. So let's start with the discharge planning one. So let me play. Let me see whether it's going to play. Is it going to allow me to play? Come on. Right. Yeah. So you can see with the, this prototype, it's just copied, like I just explained that I wrote, this prompt this morning, just to say, look at, automate workflow as nurses update the patient checklist, it automatically logs in a timestamper. So you can scan the QR code there if you want with your phone, and then it could take you to the Lovable website, and you can see a prototype of this website that I just vibe code today. So through vibe code, I managed to map out a discharge pathway on a digital canvas. It will have a checklist, notify pharmacy, update the ward, a ward board, and it became a block in my workflow logic. So this approach will reduce admin burdens, whatever. But this is just an idea of what we can do. Imagine I just did this in under 30 seconds, right? Literally under 30 seconds. I just told AI to go and build a discharge planning app for myself. And it did that. It produced this with one single prompt. Then, of course, if you look at there, it's talking about HTML, JavaScript. You don't need to know all that. Okay, you don't need to. You can keep telling the AI to say, okay, there's an error or it's not. So if you test the website now, you will see that it's not going to take you to certain functions because I only prompted it once, but I need to go further now and start telling it I need a login. I need a Firebase login because sometimes if you notice when you sign up for an account, it says, do you want to sign up with Google? So that is the Firebase. So how do you build a Firebase? Okay, so it does that for you. And then it will always tell you that go to Google, go to the Firebase, go create your account this way. I need a key and API key. You come and then you upload your API key. If you're going to integrate AI behind the scenes of the discharge planning, guess what you can do as well? You will have a fully functional AI, and then we'll explain about the more technical bits in our next session. But for now, I want people to go try. So the next one is, an equipment tracker. Simple prompts. Create an equipment tracking tool that monitors availability of specialized medical equipment. Again, scan that QR code and watch. This is crazy. It then went and it created all these things about tracking, monitors, hoists, tablets, and it can assign each ID. The user interface allows the staff to scan item and all these other things. But that was just from a single prompt. It managed to produce this. Then, we can go into Figma if you're interested in the design process of Figma. Figma, if you go on Figma website, just type in Figma. It's very good at design. So you can take a picture of a website that you think, oh, wow, you know what, that website is really, really, I love how it's very interactive. You attach it into Lovable and tell it, I want my app to look like this. It is going to go and replicate that website. It will take the design and then it will produce that. That is crazy. And lastly, the last one is vaccine reminder system. Well, it ended up naming it something else, but basically I told it that, I need to create, an app, basically that's going to have a Firebase, backend, and it will have a WhatsApp API, because I would want, if I send a notification to Mr. John Smith or whatever, it will send Mr. John Smith to his WhatsApp as well, and all that. But that's just from a single prompt. Okay, so it's managed to create this flu shot beacon, whatever. I wouldn't choose that name. But as you can see, scan again, get the code. You can duplicate this if you want to play around with it. I'm happy for people to just copy it and then create the account. You get like a free account, but then of course there's a subscription to it. I think it's about £15. I think the maximum money you probably spend, probably £100 or $100 to have a fully functional web app that you can release out there. If you can see at the top right, it says publish. You can just publish it and then connect your own domain. You can get a domain from Cloudflare for £4, Cloudflare domain website, easy. And then you got a fully functional web. So think creative. We are nurses, what can you do with this technology? This technology is here. Everybody is so scared because the pro devs, they used to spend months and months and months in building things like that. Months. But it just took a citizen developer to do this. So all we are saying is invite us. We know the patients. We spend a lot of time with the patients. So we gotta be part of the design elements, and everything. So that's how I'm gonna see things. I'm gonna move forward in the future. Again, I'm moving on to the next slide where, okay, how do we address, the fears? The common fear here is that AI or automation will replace nurses. Of course, here in the UK, they are legislating to protect the nursing title. But in reality, AI augments us. It takes care of those repetitive, time-consuming tasks, freeing us to focus on what we do best. I recall I don't know whether you recall that I was mentioning Power Automate. I created I don't know whether you've heard of Microsoft Bookings. Put a QR code, I put a poster, and then I say, okay, I need you to book an appointment. When I'm interacting with students in clinical practice and everything, and students stopped emailing our main inbox where so that really cut time. We were shortlisted for nursing times, but that was very basic. That was before AI was maturing. So think of what we can build now with Power Automate and Microsoft Copilot built in. It's a matter of you telling Copilot, go create this for me. Where people are still using Excel spreadsheet to track stuff and everything. I'm thinking, really, but we do have, it comes part of a package when you get the Office 365 license. But it's just that we as educators, we need to, we need to be on the forefront to educate our workforce. So through vibe coding, we retain control, we design the logic, and we decide what gets automated. So we are always in control, and what remains is always going to be human. So we also need to actively address bias in these systems. I know Agogo, you tagged me yesterday, where I think somebody vibe coded a picture of himself in the sun, and then the AI started producing him with guns and stuff like that. Yeah, it was like. But for me, this is where the citizen development is very important, because we as entrepreneurs, we can build these systems. We can approach the NHS, say, okay, we need the demographics, the data which is affecting our population. And then we can look at open source models. Then we can start testing them, see what are the biases there. So we have to be part of the building. We can't allow them to build these systems and release. That's why we are having these AIs. They're always going to hallucinate. They're always safe. Things that are not fake. So as a human, you're always in the loop. So data protection is non-negotiable. When we are playing around with these tools, please don't play around with them in your nursing environment. If you're going to be doing that, do a DPA assessment, whatever form, and then they'll probably allow you to do that. So all tools must be compliant, of course, with the NHS standards, which is Microsoft Copilot. It just received its quality mark check. I think I was reading it a few months ago. So moving on to open source and ethical AI. Facebook yesterday, they released last week, Llama 4 open say, it's a game changer. You can now build your own actual AI characters on Instagram now. Crazy. You should go test it. It's free. You can just, based on whatever you're interested in, and then just imagine how many people. I've created a couple months ago. I think in Shola you also, I just created my 4 days ago around sickle cell, it's already about 270,000 people interacting with it. But how are we building it? Because we can touch on what specific prompts do you need to design these models, in order for them to be, in terms of different teaching theories, Socratic teaching methods. That's why some of my AIs is like when you ask them a question, they're consistently gonna be asking you, what do you also think before they give you an answer? And if you don't give them an answer, they will not give you the answer. So until you interact and that's how I see. I think even Claude, I think Anthropic, they released an article which is on my LinkedIn anyway, where they're talking about how these AI systems going to have to be built in terms of how we educate, and they're also offering all these freebies as well. So for me, for example, a nurse-led team could train a bot, to provide wound care advice or help, explain mental health medications to families. So these models can be live on secure NHS servers and be governed ethically anyway. So we need more educational resources for nurses to understand these tools. AI literacy is vital as clinical skills. That's just the bottom line. So we have a responsibility as educators now to make sure we equip every nurse with these tools to become builders, not just users. Okay. So that is my call to action. So let's move to the call to action, which is very important. Now, what was impossible? Just think about it, I would just want to leave you with some concrete steps, really, to, start small. Like today, if you scan the QR code, whatever, or we can share with you the link to some of these tools. Try and build a micro app for a simple process or for something that you're thinking, oh, wow, I always wanted to do this. How about if you go on WordPress today, they've got an AI builder. You can just tell the AI now to build a whole entire website for you. So go check it out. Join those the hackathons. NHSE, be part of our Chief Nursing Information Officer Helen Bowsington. They're always talking about the nursing documentation. AI scribes. Everybody's talking about AI scribes. So be part of that. Be part of the conversation. Attend. Google. They're always hosting different hackathons. Across the world. Really, to be honest. Find a mentor, mentor and be mentored, share your journey at the end of the day, be on socials, encourages others to vibe quote. They're calling it vibe diagnosing or whatever, whatever term you prefer. And it's important that we embed education, in the, innovation and training. I think for me, it's, be an advocate for nurse education to include digital literacy, informatics, and no-code development. So, from a learner to a leader, you are the builder now. Okay, let's lead the digital transformation from the bedside up, powered by nursing insights, empathy, of course, be kind to each other, guys, and innovation. So, thank you very much. Any questions?
I'm still just trying to wrap my head around it. That was such an incredible presentation. Thank you so much for joining us today. Um, I have some questions, but I want to open it up to the group as well. Um, I think my first question is, how did you learn about all of this? How did you as a nurse get involved in this? How did your journey with digital technology and transformation and AI, how did this begin for you?
For me, yeah, I think it was during the pandemic. I think I've always had the technical background, but I just wanted to focus on my nursing, first year student nurse. And then we're told, COVID, stay at home now. People were not sure what to do with us. So I went and bought these two monitors and I'm like, okay, what can I do? Oh, Microsoft Teams. I know I used to do, behind the back end of Microsoft Teams. So I started just creating channels and then I started joining meetings online, where there was, and I think for the first time, all the nursing leaders, NHS nursing leaders, they were now on. It was very hard to meet the senior execs of the NHS England and whatever, but they were all now on Zoom. So yeah, I just wrote an article, on my socials around learning disability nursing, Microsoft HoloLens, virtual reality, and how we can use immersive reality to transform all these whole sensory rooms basically, and then they become like virtual places. looking at children with autism, some of them you cannot even go anywhere near them or touch them. So how do we use immersive reality? So I posted it on my social, and I think our former chief nurse, Ruth May, messaged me, on LinkedIn and say, I want you to be part of the NHS Digital. And that's how everything just gets started. But then I realized um, that I have a duty to educate now and inspire others, at the end of the day, because um, yeah, citizen development is very, I always used to question, like, we are the nurses, but why are we not really involved in what's happening, and why are we not interested in what's going on, And I just decided that I'll be the voice, I'll be the advocate. A lot of people, when they look at citizen development, they're thinking, what are you trying to say here? But we are just saying, we are here, invite us. If you don't invite us, guess what? We can vibe code now, and we can build a full stack app in literally 30 minutes. It will be like completely ready and available, and they can test it. So yeah, so these are some of the things that we are going to see that shift. There's a power shift happening in digital technology, but I saw that a few 4 years ago, where we needed to take the leadership, and empower our students and anybody who's interested. So I'm kind of like an open book, if anyone wants to talk to me about these things.
I love that. And I also just want to link this back to how, the first thing you said was that you just got curious and you started to take it upon yourself to like seek out resources just to learn about it because you knew that there was something that you could do. You knew a change needed to happen. And we have to have that spark of curiosity just to learn. I feel like myself, but I think nurses in general, we feel like we have to know the answer before we even ask the question, right? We feel like we have to be the expert in everything, but we don't have to know everything right off the bat. We are lifelong learners. And so that's exactly what you're, saying to do, just like how we build our skills as policy entrepreneurs at all. You just have to start with curiosity and learning. The more you watch, learn, read, write, and then start to talk about stuff, it becomes part of your new professional identity.
We in the UK, NHS, they use Microsoft Office 3. Microsoft is the biggest. So the starting point for me is the Power Platform. I think every nurse in the world needs to learn Microsoft Power Platform. I'll try to share a link. If you just Google Microsoft Power Platform, I think it's about these 5 apps that you need to be aware of. But they all come with your Office 365 license, but nobody really has ever gone to where it is located, which is office.com. And then you got all these apps behind the scenes. So you will see Power BI, you're gonna see Microsoft Power Automate, Copilot as well. So these are all these different systems, so you need to understand each of, just take a course, because Microsoft, they offer free courses. Once you understand that, then yeah, you're gonna be all right. Anything is, because everything now is being vibe coded. Nobody's really spending time thinking about, or people are just now focused on their prompts and how this. But Power Platform is because we're using it every day, and there are so many even before AI, they're just training our nurses on how to use of Word properly, or when they go out on a visit, they're using all these different. But yeah, digital literacy is a big issue in the NHS, and how do we, as educators, even if you read some of the research papers as well, nurses, do you think they're going to look at those papers and think, oh, okay, like the variables, that, no. How do we simplify that research paper to a normal nurse who's on the bedside, who's really thinking about, this is frustrating me. So how do we say, okay, did you know you can create a power app, like this, and then it can just help you to complete this. So people want real solutions. Yeah, for me, the starting point is Power Platform. Go and do some research on Power Platform. It will change the way you interact with technology. To answer that question, I think you will hear that we need to do a QI, quality improvement project, and then you have to go through the processes, the stakeholders, and then try to do buy-in, and then things get stuck, isn't it? Being a disruptor, nursing citizen development is really, you're disrupting the whole thing. So if you follow my journey, you will notice that I'm one of the disruptors out there, but I really passionately believe that, because because there's a lot of people who are involved in these healthcare systems, and interest, conflict of interest, and whatever. And then you are now coming up and saying, oh, we can actually build this ourselves. We don't really need you guys now anymore, or else get us involved. So yeah, so I I write my articles, I share my story, and I'll go to the head of nursing and to chief, like, nah, we need to do this. And then, there's always that politics anyway at the end of the day. But within my organization, they're very supportive, because I think people are very cautious, because AI it can start writing some stuff that you're thinking, oh my day. So people are very cautious at the moment. But for me, I thought, tell your story, write your articles, research, like Ruthie said, be involved in the research. And citizen development really is a term that Microsoft came up with. They are the ones who wrote. If you go on Power Platform, or type in citizen developer, Microsoft will come up and it will show you some of the stuff that happening in America, worldwide, in Africa as well, where when we empower nurses to build these things, look at what we produce. So for me, it's been a long journey. It's taken 4 years for people to start listening to what I'm saying. So maybe everybody's gonna start listening to me but it was a really massive thing, on my socials, talking about you need to empower us. We need to have these resources. And then all of a sudden, in 24 hours, AI came, software as a service, which is traditional building of this software. It's looking like a back in the day thing, when people are looking at this. It's that's like when you start playing around with Microsoft Power Platform, when you start building a patient agentic AI solution, that when a referral comes into your email, the AI analyzes the referral and then it comes on your screen with all this, and then it goes and connects with your EPR, and you just write a prompt to do that. Do we need software to say? Of course we do, but it's just that this is what is happening now. There's a shift, and they have to listen to us, the leaders. They have to spend time. They have to understand that they need to invest in nurses. So hopefully, in the future. But to answer your question, it's not an easy thing. When you've got ideas and you want to share these ideas. I haven't really published any. I write on my LinkedIn, but it's giving me that platform now to go and speak at that world stage to say, I believe this is how we're gonna have to build nursing teams. But some of the things I'm suggesting from a UK perspective as well is, we know it's a scary time right now. Our colleagues within NHSE, there's going to be job losses. And effectively, if you read my article on agentic AI, it's more or less I'm trying to advocate for these systems, which are going to be, I'll give you an example where a referral comes in. It is going to be analyzing all that information more than myself as a nurse will be able to capture that information. So we don't want people to start removing human beings to these processes, because that's what agentic AI is always going to be capable of doing. I'll try to find a link where I attended an AI summit for our European region. We did an AI session with the Spanish guys. Oh, wow. They already have these AI digital twins, which are psychologists, which are this, and they'll call you. If you go on my LinkedIn, I've got a digital twin that sounds like me, talks like me. This session today, we were supposed to be a digital twin was supposed to do it. You remember, Jalik, we talked about, my digital twin was supposed to run this session today, but I decided that we have to do it for the for the parts 2. So you were gonna have this whole entire session run by AI. So we got these digital twins which are coming. The way I'm seeing it is, if I can work from home for 2-3 days, and then the rest of the 3 days my digital twin do the job and they still pay me, I'm okay with that, but don't replace us. So we have to, I think this whole presentation, and I never really, there's Jessica Morley, Google Jessica Morley, she's amazing. She's doing some research at Harvard or something, Yale University. She's very an advocate around ethics, and but for me, I know we have to balance it, but I have to innovate. I have to think around, let's encourage the nurses to test it in a secure environment, build the systems for us. I'm not saying we're going to replace anybody. We are just saying that we are here now. and we are able to just go and build these solutions for us, you know. And somebody was telling me that nurses, we are very powerful because some of us were dual qualified. You know, you're gonna have nurses with finance background, you got nurses with digital background, digital nurses. So we are here, you know, we are a very powerful force, and I think we are gonna be listened to now this time.
I'm excited to see your posts on the future. And I think that also speaks to a lot of stuff we talk about in these cafes, is that kind of local to global and like vice versa, of just getting our voices in those spaces in local levels and global levels. And I mean, just like you're saying, kind of starting at even your practice level and then your healthcare system. And then, I mean, getting on these committees and these advisory boards and getting the nurse's voice in there to make sure these policies are inclusive and equitable and ethical. And then, you know, going all the way to the UN with it. That's about as global as you can get. So, yeah, no, this is great. Thank you so much.
Yeah, thank you. Yeah, it's when I got an email, I was like, oh, okay. It was that again. It's people, my mentors. People were mentoring me. They're like, I see you talking a lot on LinkedIn. I think you need to, you know what, you need to come. You need to do this. I was like, oh no. And then they helped me. You know, mentorship is very, very important. But for me, you know, when we're looking at the AI, is sort of just off topic a little bit, but the AI bias as well within our community, you know, maternal health, mental health in women or ethnic minority backgrounds, and there's a lot of stuff happening, you know. So we need to, I think for the first time as well in history, we're going to be able to build local solutions for us. I think there were people who somebody who wrote an article that people can just go and vibe diagnose now. They can go on ChatGPT and ask some of these questions, you know, and then they'll get an answer. ChatGPT is now a free AI university. So within our community anyway, just to address our community specifically issues around sickle cell, we need to be entrepreneurs. We need to build these things and go to NHS and say, we need to have the data now, you know, we got this. So obviously, NHS Clinical Entrepreneur Program, they're very, very good, you know, Health Innovation England as well. There's quite a lot of local stuff happening. And I'm seeing, Grace, you posted a lot of societies even across the world that we all have to come together. But I feel like this space as well is a very Agogo as well is doing. Angelique, you need to be a guest speaker on TikTok Live because you got a lot of Gen Z nurses there. Where are the Gen Z? They need to come into LinkedIn, you know. So we're everywhere, but how do we? You are trying to bring us all together. So I think it's important that we come together, hand over the tools to us and see what we can do with these tools, you know, because we know our patients. We really, really do. So it's time that people understand that and give us that opportunity to build the systems, you know, with their support and their oversight anyway. Yeah.
I absolutely love that. And I think that's what we're trying to do in this space here is just open up that networking to provide that visibility of nurses who are already in this space, who want to get more in this space. And, you know, we talked about engaging all the stakeholders and getting all of the people with different expertise and backgrounds. What I love is that even just within the nursing community, we can do that. We have, like you said, Lincoln, nurses that are co-certified in all these different spaces. And just bringing up this free, you know, approachable space for mentorship and for networking, we can really show that visibility. Young nurses are like digital natives, and they can really, you know, spearhead this whole AI innovations in healthcare. But on the other end of the spectrum, somebody with 40 plus years in nursing, our leadership in nursing has to extend the hand and really open up the doors for these nurses to increase their visibility in this space.
These are things that I've experienced in my career, but you know, that's why networking really helped me, because if I went to somebody and they're like, yeah, I would like to do it, and they say no, I'll always try to go to your boss and ask your boss instead. So I've always been very disruptive in that sense, where I always try to go to, I think effectively that's how I ended up connecting with so many people, from West Treating, our health secretary now, from, you know, all these different people, NMC, because I've always wanted to be inquisitive to find out, okay, why is this thing not happening now? Maybe somebody else is going to tell me why there's a delay. And sometimes I used to go to the finance director as well and say, look, can we get this? What's going on? And then you get in trouble, like, because there was just the hierarchy is something that I always used to, why are things being delayed? Do you guys understand? But this way of thinking, it really allowed me to connect with certain different people. And then when I realized that, okay, things are probably, where am I going to hear? Who's going to hear my voice now if people don't want to hear my voice? So always try to do that. But, I'm a newly qualified. I only qualified 2 years ago. So I don't want to be too disruptive, because you need to learn to work with others. So I've made so many mistakes as well as growing up, because you need to understand the principles of quality improvement, change management as well, because we are in this together, which is an area that I never really, because I always looked at that side as they're just slow in progress. We need to move. I mean, in America now, with your president, the way they're going to remove all these regulations, because how do we balance innovation, and stuff needs to happen here, because business, so the system now, the way it was designed, is no longer, that's the citizen development, because the nurses are going to be thinking about, we need to rewrite the whole entire playbook, because people want to innovate, they need to be given the space to innovate and do the work. So you need support from your chief nurse, support from your organization, because we need to work together as a team. We can catch up after this anyway as well. If you want, I can show you some of the way I'm designing the AI with the nursing critical eye, because once we have these tools, we know exactly how we want these tools to interact with our patients, which a technical guy, a dev, will never ever know. So we know this system. So when we look at it and how they're behaving, we're going to be like, but why is it behaving like that? So we are always going to be the ones in control. I don't think we're going to be replaced, but it's us who are going to be in control of it. And we are always going to look at it and say, nah, we need to stop this. This is not working for us. So, but we have to be part of the conversation. We can look at how we can really, specifically design the prompts, and and why we should incorporate nursing theories in these AI models, because they need to be evidence-based at the end of the day. So there's free courses on Google and Microsoft, whatever, but the way I'm looking at it is we need to take that information and translate it to our nurses to make it accessible for them, and give specific examples for our field, or nursing and midwifery, whatever. Yeah, because some of the stuff can be a bit too technical, and but how do we simplify it for the nurses? So yeah, happy to connect.
And just to say, can you guys see my screen?
Yeah.
Yeah. So for future connections, so like I kind of mentioned at the beginning with our intro, we can scan the QR code here to just go to our cafe website. We also have a LinkedIn, and we have a community forum as well. If you go to our website and click go to community forum, it's just a Google site, but we post highlights from each session. So I'll get to that soon, of posting some key takeaways from today's presentation and discussion. But we'll continue the conversation there. And Grace, did you just want to jump in real quick and talk about the global cafes?
Yeah, sure. So this is just like a way that we can all stay connected, continue the conversations, make more connections with people around the globe. There are obviously a lot of people who can't be on this call synchronously every month. So yeah, just a way to share who you are, where you are in the world, and what your path to a nurse policy entrepreneurship has been, and forge connections for projects and for learning. So we've got the community forum. You can find that on our website. You can join the group and continue the conversation. You can create a free account on Padlet, and you can add yourself to our global networking map. A lot more resources on our website. And you can continue to follow us on LinkedIn.